Come on. I know this is, how do you call it, last minute, but I wanted to come on and talk to you. If you are studying for the CHT exam, this is the perfect time to get started. Now, we are entering June, right? So that means that you only have like a few more months if you are planning for the November exam. But really, here, what I want to talk about is like if you are just getting started, uh, and now is a great time if you're planning for May, right? Now is a perfect time if you're planning for May of 2023. And the reason why I say that is it gives you plenty of time to study. It gives you plenty of time to map out what you're going to do, to adequately plan, right? To plan in a way that can give you some ease, plan in a way that makes it more fun, makes it more enjoyable, right? So, if you are thinking about studying for the exam, these are going to be the 5 resources that I recommend to use and study. This is essentially what I use as well to study. And one of the reasons why I pick it and why I like it so much is because it gives you really thorough knowledge, right? It gives you thorough working knowledge. I think there is something to be said about applied knowledge, working knowledge. That means like you're not just using it to memorize, to study, and then you forget it. It's really how do you integrate this what you're learning into practice, or how do you use what you're already currently doing in practice, and then because you are doing something, and then how do you understand what you're doing so that you can essentially answer the questions on the exam in a way that helps you to pass. So everything is about ensuring that you take it, and you take it one time only, right? I mean, that's really the goal here. Let's be honest, is take it and take it one time. The greatest thing about the CHT exam is if you can execute, if you can execute well, then you can get it done one time and one time only. Once you become a certified hand therapist, like that designation is yours forever. I've been a certified hand therapist for what, 15 years. And once I pass. And I know that if I pass, then you can pass too. If this is your first time here, Hand Therapy Secrets, my name is Hoang. I'm an occupational therapist and certified hand therapist, really dedicated to helping OTs and PTs become certified hand therapists and to become experts in your area. All right, so what I'm going to go over today is I'm going to go over the resources that you can use to prepare for the CHT exam. Now, if you have any questions, by all means, feel free to type it in the chat. If you are on Instagram, type it into the chat, and I'll be, come on and answer it. If you're watching me on Facebook or YouTube, you can enter it in the chat as well. Let me know if you have any questions. And of course, you can always slide into my DMs and ask me some questions there too if you're kind of too shy to put it into the post. But honestly, share it, share your questions, because one of the most powerful things is sometimes when you're in a room or you're watching, it's not just the questions you have, but you can learn so much from the questions that other people have. So I'm always encouraging people, put your questions in the chat. Don't be shy about it, because it's through the questions that you'll learn, and it's through your questions that someone else can learn as well. All right, so what are the 5 resources? Well, I don't know if you know, but if you don't know, I'm going to tell you right now, my number one choice is not everyone's favorite, but it is my favorite, is Rehab of the Hand. Rehab of the Hand, right? If you don't know it, look it up. It's Rehab of the Hand. I absolutely make no money off of this book. I am not an affiliate. I did not write any chapters of this book. But Rehab of the Hand has been around for like a gazillion years, I'm sure. For as long as hand therapy has been in practice, I'm sure Rehab of the Hand came out. I don't know the history of the Rehab of the Hand, but I do know it comes in volumes 1 and 2, and we are on the 7th edition right now. Volumes 1 and 2, and we're on the 7th edition, right? If you have the 6th edition, it's a little bit dated, but if you're in my hand exam prep program, please don't worry. People who are in my program, I tell them that's okay. You don't have to worry about getting the 7th edition, because one of the things I do is I gap the knowledge between. But if you don't have Rehab of the Hand book yet, definitely grab the 7th edition. It is one of the #1 sources in terms of resources to use to study for the CHT. Now, who is this book not for? Let me clarify, right? Because if you are talking to a CHT, maybe that has been a CHT for a while, they might tell you, yeah, this is the gold standard, right? But let me explain who it's for. The only time you really, really need this book is when you are studying for the exam. Now you can have it as a resource in your clinic and all that good stuff. I'm a huge fan of it as a resource, but is this like bedtime reading story, or like, oh, let me just read this shit for fun? It is not fun. Is it good for you? Yes. Is it good for your practice? Absolutely. Is it good for you to use when you're studying for the CHT? 100%. I use this, all day, every day. When I was studying. Now, I can only talk about what I did when I was studying 15 years ago. I used the Rehab of the Hand, the yellow book. So I know someone asked me this before. If you have the yellow book, I'm sorry, it's really, really dated. Get a new edition, right? Because there are some updates in the current surgeries. There's updates in protocols. There's updates in terms of how they want you to think through stuff. So yeah, if you're studying off the yellow ones, that was when I took it 15 years ago. I studied off of that one. And I remember when I was studying off of that one, I had the red ones, which were like, I think the first volumes. No, it wasn't the first volume, but it was like pretty close. And I remember looking at those books, and I was like, this is kind of old. Should I still be using this? And I was like, you know what? If I'm going to study, and I'm going to study in a way that helps me pass the first time, because I had pressure under my ass. Like, I don't know about you. Sometimes it's self-inflicted, but I got a job, and I told them, like a badass, give me this job and I'm gonna become a CHT. And if you're out there and you're doing this too, boom, okay, suck it up, buy the 7th edition. And that's what I did. I got the latest edition, and back then it was the yellow edition. I don't even know what edition it was, but it was the yellow ones. And um, it is heavy reading. So let me explain who it is not for. If you are a brand new grad coming out and you're starting to learn how to be a therapist, how to be an occupational therapist, and then you're kind of learning how to be a hand therapist, this is not your go-to book. I'm sorry. It is thick as all hell. If you start in chapter 1, you're gonna you're just gonna quit, right? And it is absolutely no fun. It feels like you're reading a different language. So don't do that to yourself, because unfortunately it can be really discouraging, and I don't want you to do things that are discouraging. It is very good for someone who's getting started studying for the CHT, right? If you're starting out and you're not studying for the CHT, use another book. I'll make another video. You can send me some questions and ask on that. But Rehab of the Hand for sure, 100%. 7th edition, volume 1 and volume 2 is for studying for the CHT, right? Now, let me share a little secret with you. These books are expensive, but totally worth the money. They last for a really long time, especially if you're buying the latest edition. It will last for many, many years for you. But if you work for a place, You know, if you work for a company, you work for a hospital or wherever, it doesn't hurt to ask your employer to buy, you know, this book for you and have them use it as a resource in the clinic. So it doesn't belong to you. It could essentially belong to the clinic, and you, or the recipient, get to use it. But then it could be there for anyone else who wants to study after you, who come in after you, because there's always going to be somebody after you, right? So Rehab of the Hand. So that's one way to save. Or you could be like, we have it here, but sometimes my therapists want to buy their own because they want to highlight the shit out of it. They want to write all in it. My copies are pristine. I don't write in it. One thing that I did when I was a student, when I was studying for this, I had to sit there and photocopy it. Oh my God, I wanted to die because I had to sit there and copy it page by page. Nowadays, you buy the 7th edition. Do you know that you can access it online? So, which means if you can access it online, maybe you can print it. I'm actually not sure about that, but I just thought about that. Maybe you can print it, but some people love using it online. They don't have to carry it. I remember studying for mine, and I would do chapters and I would staple them together because I was traveling and I wanted to study. I wanted to study while I was on vacation. Well, I'll tell you more about that later. But Rehab of the Hand, absolutely number one choice when I was studying for the CHT, and it still remains my number one choice that I recommend for people when you're studying for the hand exam. All right, and my second choice, is the Purple Book. So the Purple Book, you know, is it's a great resource. Now, it's a great resource to study for, not because I don't believe in using it to study, because though it does have certain amounts of information listed out, the Purple Book is actually a really great resource to practice questions. They, I think, have the biggest bank of questions from all the different resources that are out there. But it's not just the number of questions, it's how the questions are worded. Now, some of the questions are simple and whatever, but some of them in there challenge you to think, right? It challenges you to make decisions. And one of the biggest things about doing practice questions is the ruling in and ruling out of stuff, right? The ruling in and ruling out of stuff. Give me 1 second. My door is just making a lot of noise, and I had to do something to shut that down. So, so the Purple Book. The Purple Book is a great resource for you to use as practice questions. Now, if you buy the Purple Book, I do believe it comes with a practice exam, like a whole one. So as you're studying, one of the top resources, you know, really is to do the practice exams, right? So sometimes the Purple Book, I think it comes with it, but let's say you're buying the book used, right? You might want to buy your own exams, right? But do at least 2 exams, right? And do whole ones. So one of the things when it comes to, you know, preparing for the CHT is to prepare for the whole length of the exam. Now, I don't know about you, but when I took it, I was 5 or 5.5 years out of being in school. So since it had been a long time since I've been in school, I hadn't sat for an exam where it required me to sit there for 4 hours and to think nonstop. Like I hadn't been out of school and I hadn't done anything like that in a long time. Now, if you're a therapist and you've been out of school 5, 10, 15, 20, 25 years, it really doesn't matter. I think that if you have always wanted to become a certified hand therapist, there is no limit to when you can do it. There is no time stamp that said, oh, you have to be X age to be able to do it. I think it's very possible to do it no matter your age, no matter how much longer you have in your profession. I think as occupational therapists and hand therapists, certified hand therapists, we have a lot of longevity in our career. And let's be honest, we have longevity in our career when we do the things that we love doing. If you love treating, if you love helping your patients in a way that can be very satisfying, it's now work. If you want to become a certified hand therapist because you think one day you want to be in a position where you're teaching, having your CHT can be really a great benefit to you that you can do for a really long time. Like, for example, when I studied for the CHT, I didn't know I was going to teach in the manner that I'm teaching now. But I always thought that I would love to teach. I thought maybe I would love teaching at the university level. I thought maybe I would love teaching, doing weekend courses, So I think that there's a lot of opportunity. Sometimes we have to create some of them. I don't know if you guys know, but Debbie Schwartz, she works for Orfit, and she's a CHT, and all she does is, I mean, I know this isn't all she does, but she gets to go around and just make splits and teach people how to make splits all the time, you know, and she can do that for as long as she wants. I mean, how amazing is it? I talk about like her job, and she's like, well, there's some other stuff involved too, of course, but the idea is like she's really good at it. She she enjoys that craft, that aspect. Having her CHT really helps for her to have gotten that position, right? You have to, I might share with you at another time the YouTube video that I had when I did an interview with her. Look at Susan Weiss. It's actually been, I was thinking about her this weekend, and she's the author of the Purple Book, and she unfortunately passed away last year, right around this time. I think it's next month, to be honest. But I was thinking about her, and she really loved doing what she did. She became a certified hand therapist, within the 5 years that was allowed. But she worked on her book and worked on her company, and there were so many options for her. She could teach, and she created her own path. So I just think if you want to become a certified hand therapist, really honestly, there's no stopping you. There's no stopping you. Like, if you want it because you want it. I was talking to somebody who had like a lot of years of experience, and she's like, I just want it for me. Of course, you should want it for you. Who else would you want it for? And it doesn't matter how old you are. And she was like, yeah, a lot of people tell me, oh, well, it doesn't matter. All the doctors know you, they know you're good. But you know what? Sometimes doctors retire, sometimes they move away. Like, one of the hand surgeons I worked with loved. We worked really well together. I actually ended up leaving that hospital system, and within a few years, he left. Had I stayed and I just banked on the fact that he liked me without being a CHT, I would have been screwed, you know? So there's no limit. But if you're going to be a CHT, not only do you have to have the years, you have to have a minimum of 3 years, right? You have to have a minimum of 4,000 hours in upper extremity management. I talk a lot about what is required and some of the myths and stuff like that that you don't have to have in other videos. But when it comes down to it, you have to pass the CHT exam. Rehab of the Hand, the Purple Book, and do some practice exams. There is too much, right? There is too much. So my recommendation, I recommend it. This is what I did, so I can only share with you what I did. This is what I've shared with other students who've passed the exam. A minimum of two exams. You can overdo exams, just like you can overdo unhealthy. You can overdo healthy as well. So that's my recommendation. But take the whole ones. Don't just piecemeal your thing, because there's a strategy in terms of how you would take it and how you would self-analyze yourself so that you could know how to make gauges and changes, right? It's just like anything else. Like if you think about it, like for example, like a high level athlete, a basketball player, they have their coaches like monitor and look at what they're doing and then make little tweaks and changes to help them be successful the next time around. So that's the same idea with how you would use the practice exams so that it wouldn't you can analyze, you self-analyze basically, right? So that's number 3. Number 4 is the ASHT book. Did I not ever? Why do I do this? I never give myself enough space to write. So let me write it up here. Rehab of the Hand, Volume 1 to 7th edition. 2 is a purple book. And they're on the 4th edition. I mean, if you have the 3rd edition, it's not a big deal. You just get more updated information, I think. And then 3 are the practice exams, right? So, but whole ones. Don't just don't half-ass and do like 50 questions, Number 4 is the ASHT book. Back then we called it the black book. They have a new edition now and it's blue. Right? But the American Society of Hand Therapy creates a book. And this book is more like a review and it has an outline. So all these books, they have their own, like they create their own outline. And so a lot of times when you use a lot of different types of resources, you have to like kind of piece them together. So normally I would say people who use the ASHT book don't use the Rehab of the Hand. Some people who use the Rehab of the Hand don't use the ASHT book, right? Don't use a black book. So I think that really in between the Rehab of the Hand and the ASHT book, my recommendation is pick one. Pick one and stick with it. But then these two, the purple book and the practice exam, for sure you want to have it. For sure you want to have it, right? Now, with the ASHT book, the black book, it, like I said, it's more of an outline. So it's a little bit of a review. It's already almost going as if you already know some of the information, right? And it's just a different way of organizing it. So check it out. If you have an opportunity to borrow someone's black book, check it out before buying it. I personally could not use it. I personally did not like it. But do I help people who like it use it? I do. Because there are some people who just cannot stand the Rehab of the Hand. They do not like it. They cannot read it. It is like too much for them. So they opt for the black book. And that's fine, but there's ways in which to use it, and I think it just depends on what you have, like how you learn. Like we're all different learners here, and so you really have to decide like how you learn, right? And then of course, my ultimate favorite is the hand exam prep that I do, program that I have. And that is obviously my ultimate number 1 choice. No, it's a great resource for you if you have a hard time reading all of it and you have a hard time understanding a lot of the concepts. You just want to learn faster. You want to be able to go at lightning speed. You want to be able to have someone who can answer your questions and go over concepts with you so you're not doing it alone. It's a great program. So here's, how I use the ASHT book, and I've had other members in my program use it. Now, because I said it was more of an outline approach, they are able to use a hand exam prep program essentially and watch the videos. right? And then the way they use it, they watch the videos and grab their notes, write their notes down, and they take it and fill in the blanks in their ASHT book, right? And that's essentially how they've used it. I've had one of my members. She came into the program. She was kind of studying a little bit before, but she was stuck in the rehab of the hand. She's just like, I can't read it. It's so boring. Every time I try, I get anxiety. I fall asleep. I just like nothing sticks, right? But she really liked the outline. But the problem with the outline, the ASHT book that she was finding that she was doing is she was having to go out and search for the answers all the time because, like I said, it was an outline. So if you're going and you're Googling stuff, the Google has a lot of information. The thing that helps you is also the thing that hurts you, right? It has so much information that you're like having to weed through the shit to get to the gold, right? And that's extremely time consuming, and she just didn't have the time. She was a full-time therapist. She had a kid. She was pregnant, having another kid, and she was like, I'm not struggling and not passing. So she goes, I didn't want to keep wasting my time looking to Google for answers, looking to YouTube for answers, but she could not stand the Rehab of the Handbook. So what she did was she came into the hand exam prep program. We devised a plan for her. And, I've talked about the plan before, so I'm not going to go into this today, but one of the ways that she used it was because she hated the Rehab of the Hand to really read it. She'd only use it as a resource, but really what she did was she watched the videos. She watched the videos of the Rehab of the Hand, and then she took the notes and applied it to the ASHT Black Book. And because of the way it was broken down, she really liked the way it was broken down. She was able to use that information and very succinctly be able to cover all the major topics that the CHT exam requires you to study. And then she would use the purple book for practice exams, and then she would take at least 2 practice exams before taking it, and she passed the first time, right? So it's not just a plan, but it's in how you execute. It's how you study in a way that helps you to understand, not just memorize, right? That's the thing that will cut your time in half, where you study to understand concepts and then apply that to treatment. And if you're treating, you can treat and say, how am I using my treatment or my current working knowledge, and then apply it to all the things that I need to know in order to answer the questions in a way that helps me to pass. You only need a 75. Let's stop being perfect, people. We do not need to be perfect. We need a passing score, and that's it. And it comes down to being able to make decisions. When you treat, you're essentially alone in terms of your decision, in terms of what you do. And being able to make decisions on the split second when something happens with your patients, it's really key. And that is the same as on the exam. When you're in the exam, you can study with a group all you want, right? I promote studying within my group. I promote getting study buddies where you can go and you can go through practice questions. You can, you can grill each other. You can ask questions of each other. But really, at the end of the day, when you're in the exam, you're kind of alone, and you're in your head by yourself. And you've got to understand concepts and then know how to critically think through and make decisions. And when you make the right decisions and you make them 75% of the time, you'll pass. And you'll pass the first time. So that's my goal for you. I get this question a lot in terms of what are the resources that I can use to study. And I'm just sharing with you what one personally I've done, and I've been able to pass, the first time. I've been a practicing therapist for a little bit over 20 years. And before I went out on my own, I helped my friends. And then when I went on my own, every single therapist that has worked with me has become a certified hand therapist, right? Whether they've stayed the whole time or, eventually they leave and they become a certified hand therapist, right? But I think one of my very first ones that I hired full time here, she got her experience that she needed. She was coming from a skilled nursing facility, and like, hey, kudos to people who work in skilled nursing facilities, because honestly, those people that are there need love and care too. Those people in a skilled nursing facility have 2 hands and 2 arms that could use a lot of love and care from people who have skills working with hand and arm injuries. Right? Don't discount these people just because they don't have tendon tear, like tendon lacerations. They might have tendon ruptures, right? They're gonna have fractures. They're just maybe not gonna be crush injuries and like partial amputations and stuff like that. But people of all ages, require a hand therapist at some point, or fashion, essentially. If you take a look, I worked in the NICU and I got a chance to work with babies that had brachial plexus types of injuries, missing, malformed thumbs and things like that. So, you kind of need to know your shit. And then you can work with them when they're little and toddlers and kids that break their arms. You can work with adults. You can work with older adults. You can work geriatrics. All these people will have 2 hands and 2 arms and every possible chance for you to help them. People with strokes, oh my gosh. I was just talking to a therapist that is in a skilled nursing facility. She wants to become a certified hand therapist. I'm like, kudos to you, because we for sure need them in every setting. And I know of CHT personally that have worked in skilled nursing facility, and people with strokes, all these neuro types of cases become orthopedic types of cases. And believe it or not, it's in Rehab of the Hand. You've got to know how to work with spinal cord types of cases, stroke types of cases, not just like fractures and stuff, even though that might be a majority of your questions. Tendons might be a majority, shoulders might be in there, nerves are definitely in there, right? So these are essentially my top choices. I'm going to go over Rehab of the Hand, volumes 1, 2, the 7th edition. Purple Book, the 4th edition is the newest one. Practice exams, you can get them just about, there's only a few places really where you can get them, but you can get them like whole practice exams. I believe Live Conferences, that's actually the parent company of the Purple Book. You can purchase like whole ones. And then the ASHT Black Book, the American Society of Hand Therapists, put out a new edition, and their new edition is blue, but I still call it Black Book. And then of course a hand exam prep program, and this program is really great for somebody who wants to take the exam sooner than later. If you're done putting it off because you haven't been able to study on your own, every single time you start reading the Rehab of the Hand, you put it down because you keep falling asleep. Every time you start reading, you read, and like 2 or 3 hours later, you feel like, holy shit, I don't know what I read. I don't understand everything. So if you want to study all the critical topics that's going to be on the exam, and you want to do it in a way that's sooner than later, the hand exam prep program is a great program for it. And this program is just different from all of my other programs. So I know that some of you guys have maybe heard me talking about my orthosis class in Orthosis 101, or even my live workshop that's coming up in about, oh my God, in 2 weeks. It's nothing, the hand exam program is nothing like that, because in our workshops, we're doing the thing, right? We're making the splints. In the hand therapy mentorship program, we're always talking about how you want to develop your skills. And in that program, we're talking about doing stuff as well. In the hand exam prep program is about tying all of that doing back to concepts, back to major understandings of anatomy, understanding injuries, and we'll be able to cover all the topics of anatomy and diagnosis, protocols, and pretty much all those things, where then you take that information and you apply it to treatment, because you're going to have so many different types of questions on the exam. And really my goal here is to get you as prepared as possible, so that you know how to answer all those questions and be able to make decisions on them. right? So if you want to take it sooner than later, message me. If you're on Instagram, send me a message. If you are on Facebook or YouTube, you can send me a message as well. You can leave a comment, you can email me. On our website, handtherapysecrets.com, there's a way where you can apply to be in the program. I'm becoming more selective in who I want, because I want your success. I want to help you succeed, and I don't want. One of the reasons why I offer discovery calls is I just want to make sure that this is the program you need to help you to prepare to pass, right? So it's for someone who's just fed up with putting it off. It is for someone who studies in a different way. Like, just reading is just not enough. You need to hear it, you need to listen, you need to watch, you need to move. You want to have the support of someone who can answer your questions in a way that helps you to understand, and not just understand, but retain the information, right? If you want to study smarter and not harder, I know it's counterintuitive. It's counterintuitive. Everyone's going to tell you spend a shit ton of hours, study for 2 years, study for a super long time. You need to put all your hours in it. But I, through my method, do believe that there's a way to do things where it's smarter and not harder, right? So, so that you can take it, so that you can take the exam. You can't become a certified hand therapist if, one, you don't study for it, and two, if you don't take the exam. You study for it, but if you're not taking the exam, it's a problem. We need to get you to the exam to take the test, right? And I'm looking for someone who's coachable. You're a great therapist, you desire to be a great therapist, and you want those credentials, right? So send me a message. It's Hoang at handtherapysecrets.com, or actually that's kind of hard if you don't know how to spell my name. So that's okay. You can info at handtherapysecrets.com, and that will get to me as well. But you can always go on our website, handtherapysecrets.com, and I invite you to apply to enroll into the program. I am taking new members right now so that I can prepare you for May of 2023, right? So let me know if you have any questions about that. But take this down. These are the 5 main resources. And if you have any questions about that, feel free to send me a message as well. All right. So any questions, any concerns that you have in terms of those resources? And again, even though Rehab of the Hand is a favorite, I use it in my program immensely. It's how I lecture, how I break down the information in there. That makes it easier, helps you to understand concepts. But really, at the end of the day, if you look at any other resource, they're actually going and taking the information from Rehab of the Hand and using it in there. So if you look at the purple book, if you look at the ASHT book, let's face it, they're using Rehab of the Hand. I mean, there's a couple of other ones, but Rehab of the Hand has a majority of what you need to know. So I'm here if you are looking for help in terms of studying for the exam. If you're just not really sure what you can do, if you're not really sure what this program can do for you, send me a message. I'm happy to talk it over with you and see what we can do to get you to the finish line. And it's really not the finish line, if I'm going to be perfectly honest. It's just a different starting point. All right. Thank you very much. I gotta actually go get on a phone call in like 10 minutes. So I hope you enjoyed it, and I hope to talk to you guys very soon. Thanks. Bye.